Hi, my name's Jay Schafer, and I'm going to be speaking with you today about my practicum project that I completed this semester with the Montville Township Department of Health in good old Montville, New Jersey. When I say click, please advance to the next slide. Click. So, access to health services is an important aspect of all healthcare, and it's one of the leading health indicators of Healthy People 2020, which means there's been chosen as an area of particular focus or attention to gauge how well we're doing overall with regards to the healthcare of the population in the United States. So, with access to healthcare services, there are actually three steps, two of which I think are often overlooked, the first two. So the very first step is actually knowing where to go when you have a question or a concern or a problem with your health. Do I go to the doctor? Do I go to the emergency room? Do I go somewhere else? Which doctor, which clinic, which specialist may I need to see? Or who do I turn to for as a trusted advisor when I'm having problems or have questions about my health care? The second step is actually physically getting to the location. Um, it may be across town. It may be difficulties with transportation. Some people don't own cars, or buses may not run that way. Um, or there may not be a doctor or specialist in your location that actually is able to treat you with regards to that specific issue. And the final one, which everyone defaults to right away, is payment. Who's going to foot the bill, or who's going to reimburse for the services that you need? So despite all of the wonderful advances in technology, the advances in medicine and the prevention and treatment of disease, diagnosis, improved imaging, and diagnostic tests, all of that is virtually meaningless if you don't have access to it. So that's why it's one of the leading health indicators in Healthy People 2020. And as I mentioned, prevention is a part of that. And the old adage, an ounce of prevention is worth a pound of cure. Well, that's absolutely correct. This has been proven over time that the value of prevention and the services provided and the costs incurred are it's more cost efficient to prevent a disease rather than treat a disease. And over the last decade, we've seen a big movement towards that, where physicians and insurers and other healthcare providers are paying more attention to the prevention aspect rather than the treatment aspect. And Montville is a fairly well-to-do area, upper middle class, good transportation, good a lot of services nearby. Yet access to health services is still quite a bit of a local problem. Click. So the purpose of the project was based on a discussion that I had with the health director before the semester started. And, we discussed some of the needs and how I might be able to help. One of the areas was the lack of participation in health screening programs. The participation has been declining over the last several years, and they really wanted to take a look at that. So based upon that and some other discussions, we came up with three goals for the project. So the first one was to increase participation. The second one was to measure attendee satisfaction and gain some feedback. And the third, and a very important one, was to increase the number of people who report that they have a primary care provider. So that gets to the knowing where to go when you have a healthcare problem. Click. So I'm a big fan of the proceed model, which is good because it includes a logic model, which was we needed to do at the start of the semester. But that really guided and the structure and helped guide the process. It guides the proceed process actually when used properly. Formative research was done to get local assessments, and then additional research was done to look at the evidence and understand what some of the best practices are. We did literature searches. I looked at the adoption of screenings, the avoidance of screenings, why people go and why people what they don't go, and we with the staff, we developed an evaluation measure. Well, we created measurements. So what are we going to measure? How we're going to measure it? Why we're going to measure it was very important to determine up front and overall. We looked at the communication, we looked at literacy. We developed the communications to remove the barriers if they existed, or perceptions, and what would encourage people to go. And the implementation was key. We need to get it done. So at the end, we had outcomes, we had measurements, and we looked at it and we learned some lessons, which we're going to talk about in the next slide. Click. So guess what? Yay, we did it. Now we can all breathe. It's all over with. It happened a week or so ago. The good news is participation increased by 11%. The number of attendees providing PCP information increased 16%, and the satisfaction rating was really high overall. And we received some very good feedback that is going to help us moving forward. We found out a few other things, like we made some new outreach contacts. We had new participants from low-income housing, which was one of our target populations, which was good to know. And we gained valuable information on the actual tests performed that are going to be used to help inform and develop future screening programs. So the biggest news for me and the township was that everything went really well, and they liked it so much that they're going to take a lot of the things that were developed and they're going to adopt them as practices within the department for future healthcare screenings. Great news. They're going to use the spreadsheets and the communications as templates and the surveys as templates, and they're going to implement that to help ensure consistency and longevity and sustainability of this programs moving forward. So recommendations. First of all, seek first to understand the full situation. I went in there with a head full of knowledge, and guess what? Some of it really didn't matter. I had some really grandiose ideas that just weren't going to work in this situation. So really take time to listen and understand and get a grasp of what's really going on. Gain early buy-in, gain agreement early. I started some work a little on my own without speaking to someone, and they said, we're really not interested in that, or we don't want to go in that direction. So make sure you discuss everything and get buy-in very early. Evidence, schmevidence. So who knows? Truth is, research, and when you're done, do more research. I found that to be the greatest, probably the greatest thing that helped me in my discussions, in my planning processes, gaining the buy-in when needed, and developing a program that turned out to work in the end. Listen to those who have gone before you. There's no substitute for experience. They may not have an MPH degree in health promotion, but guess what? They've actually done it for a while, and there's a lot to be learned from that. So make sure you sit down and you listen to people. Maybe you agree, maybe you don't, but it's worth a listen. Leverage existing resources. Make every penny count. It's important that this is, works within budget, works with available resources, because guess what? Funding is getting harder and harder to get, and it wasn't an option in this situation. So if where you can, make every penny count. Dig deep into the community. Don't assume you know the community. I mentioned earlier that Montville is a fairly well-to-do area. Well, guess what? There are people in there that you may overlook, or pockets of the population that you may not recognize at first. Don't assume you know everything. Just you can't judge a book by its cover. So ask questions, dig deep, probe a little further if on anything that maybe you might have don't overlook anything. Dig deep and make sure you get all the information that you can. And lastly, multiple channels and methods have the greatest probability of success regarding health promotion. Don't put all your eggs in one basket. This was seen by previous attempts at the staff, and they just said, well, let's do more of this same thing over and over again. Well, rather than branching out into new things and new channels, and so multiple methods, multiple channels are going to give you the greatest success. And that's very simple explanation in 10 minutes or so. Thank you very much. I appreciate your time, and references are at the end. You know where to find me if you have any questions. Thank you very much. Take care.